Hi, I'm Rick Mayfield at Nutridyne's Chief Science Officer. Today I'd like to talk about Dynamic Collagen Renew. It's been almost 2.5 years since I created this label, and I'm very excited about this product to this day because it's clinically quite effective and usable for your patients. Initially, I noticed that as I was going through the local stores, collagen was everywhere. It's like collagen, collagen, collagen. So I thought, well, let's look at this a little more directly with the science. And what I found was that the most significant science was coming out of Germany. They were doing clinical trials identifying certain collagen peptide sequences and identifying what those were and creating a specific trademark, whereas most of the products in the market are just generic collagen. We don't know if, really most of the time where it's coming from, whether it's fish, chicken, beef, pork, other animals, we don't really know. It's just all thrown together as type 2 collagen. So they may be okay, but we know this product has very verifiable science behind it, and we are getting good clinical results. It has 4 primary collagen peptides. The first one is called tendoforte. Tendoforte influences tendons and ligaments. Our tendon and ligament fibroblasts, like say, for example, our Achilles tendon, have been studied in animals and in humans, and we know that these fibroblasts, they produce significantly more tissue matrix when they're exposed to tendoforte, like 1.2 to 2.4 times higher. Also, the synthesis or creation of elastin, the most prominent component of the ligament matrix, is increased by 50% with tendoforte. A study done out of Australia at the Australian Institute of Sport, they gave athletes who had chronic Achilles tendinopathy, these 20 subjects were having problems getting back to their workout routine because of pain and discomfort and impairment. Over a period of 6 months, they were giving 5 grams of tendoforte. Within 3 months, 12 out of the 20 participants were able to return to running after starting a therapy with daily intake of these 5 grams per day. Just keep in mind, these subjects were not able to do this until they started consuming this product. The second ingredient is called Fortigel. Fortigel improves the mobility and functionality of our joints. And the German scientists have hired various universities, including Penn State University here in the United States. They took 147 athletes and they measured their activity-related joint pain. In this prospective randomized double-blind placebo-controlled trial, they used visualized analog scales to measure their joint pain status. There was a very clear-cut difference between those consuming this product and those not in joint pain. They were able to rest, stand, walk, carry objects, and so forth with Fortigel. A study out of Germany at the University of Freiburg in young adults, after only 3 weeks of taking this Fortigel compound at 5 grams per day, there was a significant improvement in pain, stiffness, and physical function. And this persisted even after 6 to 12 months by taking this product. Overall, more than 40% of all patients completed a pain reduction level and achieved a 70% positive effect of the therapy could be demonstrated in this study. Another study done at Tufts Medical Center with Harvard University, they gave them a double dosage of 10 grams of Fortigel per day for 48 weeks. This is one of the most famous studies I've ever read. It's really insightful. The Collagen study published in Osteoarthritis Cartilage, they took 30 subjects. They did MRIs before, MRIs after. This was gadolinium-enhanced MRIs. They could light up the cartilage, see what was growing, what was not, how much degeneration was going on. They could see changes in cartilage cells at the 24-week mark. That was halfway through the study. Only the group that was ingesting Fortigel could see the changes in joint structure. So here it's actually creating new cartilage growth, restoring cartilage function. I've never seen studies showing arthritis restoration. So what they found is that these cartilage scans produced a significant increase in the proteoglycan density in the medial and lateral regions of the tibial plateau in the knee compared to the placebo group. A few years later, they took the analysis of this group and they took their blood and evaluated. What they found out was that the type 2 collagen synthesis significantly reduced the proteoglycan degradation, and they had basically counteracted the progressive wear and tear process of these arthritic joints. They've looked at the hips and they looked at the knees, and we find clinically my patients with hip and knee problems, ankles, shoulders, and so forth, better range of motion, less pain, more functionality, and actually seeing improvements on MRI. We've been having this product now for almost 2.5 years. The third ingredient in this product is called Fortabone. Fortabone stimulates the synthesis of bone collagen matrix. It has the benefits of improving osteoblasts, which counters the osteoclasts, or breaking down bone tissue. So it has a 1-2 punch all in one step. This net effect is it improves the collagenous bone matrix. As an example, in a placebo-controlled double-blind study, they gave women over a 12-month period 5 grams of Fortabone. That's the exact amount that's in this product in one serving. They did DEXA scans, and they found that the bone density greatly improved in the spine and in the hip, femoral, neck areas. They found there was an increase in bone mineral density after Fortabone supplementation in women suffering from osteopenia and osteoporosis. The next ingredient is Verisol. Verisol is an interesting collagen peptide that improves skin and nails area of the dermis. The first study that we looked at was a double-blind placebo-controlled trial in 2013. They took 69 women aged between 35 and 55. They found that the amount of Verisol that's in this product, that it improved skin elasticity by 15%. And after just 4 weeks of treatment, it persisted after 8 weeks after the administration was stopped. So we can see that it has a persistent effect. They've also found that it reduces wrinkles after 4 weeks of taking this by increasing collagen levels by 60%. Again, these are women between ages 45 and 65. The level of Verisol in this product is the same as what's in this product, is 2.5 grams per day. The same level of Verisol content of peptides helped decrease cracked and chipped nails after 2 months of treatment, reaching a decrease of 42% after 6 months. A significant improvements after 3 months of therapy. So overall, there's less nail peeling, less nail edging. You've had patients with chipped nails. What can I do to help integrity of my nails? This is an excellent product to use for that purpose. So in summary, we have the Fortigel at 5 grams, Fortabone at 5 grams, Tendoforte at 5 grams, and Verisol at 2.5 grams, all in one scoop. As far as I'm aware, there's no other product in the market that has all 4 of these peptides in one product. The dosing typically is 1 scoop per day for most patients. If someone has a very active arthritis, often we'll start off with 2 scopes per day and continue that for 3 to 5 months to give them a more therapeutic level of the Fortigel content. But people with arthritis, tendonitis, sports injuries, people having ligament tendon problems, people who are not healing as quickly after injuries, people with cracked and split fingernails, irregular shaped nails, lots of wrinkles, loss of elasticity, and for sure osteopenia and osteoporosis. So for more information, you can click here.